Hello, everyone. Welcome to Ruminate This with Agrarian Solutions. Join us as we explore ruminant nutrition and the impact of mycotoxins. Here, we challenge your curiosity and explore new industry insights and research to optimize your herd's health and performance. All right, welcome everybody to another episode of Ruminate This with Agrarian Solutions. I'm your host, Scott Zaire, and today we are going to be talking with Dr. Larry Roth, Vice President of Nutrition here at Agrarian Solutions. And Larry, what we're talking about today is, I know, something near and dear to your heart, mycotoxins. But in particular, I'd like to pick your brain a little bit today on specifically a portion of the animal's life that we really don't ever think about mycotoxins or doing something about mycotoxins, and specifically in the pre-weaned calf. And then, maybe we can talk about some of the virgin heifer population, the post-wean stuff too. But yeah, thanks for coming back on the podcast today, Larry. And
Good to be here.
So I guess my first question would be, should we be concerned about mycotoxin mitigation or the damages that mycotoxins can cause in pre-weaned calves?
You bet. That's a fantastic question. The short answer to that, should we be concerned about mycotoxins in the pre-weaned calf? The answer to that is yes. And then the question is, why should we be concerned about it? And I think the simple answer to that is mycotoxins change nutrient allocation. So, Scott, we can talk about the price of milk replacer formulations, and we can go through that. We can talk about starter feeds and so forth. But we think about starter feeds being a source of mycotoxin because we've got so often byproducts there that are concentrating the level of mycotoxins that were present in the base feeds that the byproducts came from. But you've got a young animal, in many respects, a pre-ruminant. The rumen, that great fermentation vat that can break down some mycotoxins, is not developed. And so we should be thinking about the pre-weaned calf as being, in some ways, almost more similar to a broiler chicken or a feeder pig than to the lactating cow that it will eventually become, or the feedlot steer that it might become.
So, you mentioned the rumen, right, not being developed, and we're feeding it a starter feed to develop the rumen that could potentially have mycotoxins in it.
Mm-hmm.
What kind of inhibiting factor does that maybe lend?
You bet. So again, it all comes back to defending and protecting the right nutrient allocation. And that can be as simple as nutrients are going toward proper immune function and going toward growth with the pre-weaning calf. Now, if we have mycotoxins attacking the small intestine lining and destroying cells, now the calf's got to put nutrients into repairing the small intestine. Well, that's nutrients that didn't go toward growth. That's nutrients that didn't go toward developing internal organs that produce enzymes to help break down the diet. That's a reallocation of nutrients that otherwise could go to even developing the rumen lining.
Yeah.
So I'm thinking here, Scott, that mycotoxins attack the small intestine lining. They may be attacking the rumen lining, and the body has to repair that damage, and then has to also deal with anything that the mycotoxins might be doing to the liver, the body's biochemical factory.
So treat me like I'm a calf manager on a dairy, and Larry, what are some of the challenges that I should be looking for, or maybe signs that this could be an issue?
You bet. A fantastic place to go. How would I know if I have mycotoxin issues with my calves? Are your calves meeting your weight goals at weaning? Or how much starter feed is that calf consuming at weaning? Tell me about incidents of antibiotic treatments, electrolyte treatments. Tell me about calf survivability. Because if we've got mycotoxins present and changing the allocation of nutrients, because we're damaging the small intestine, we're impairing function of the liver. All of those other items are going to suffer. Calves aren't going to weigh as much as they should. If calves aren't growing, they're not eating as much starter feed. If the calf doesn't feel well because it's got other health issues, because the immune system is drugged down dealing with the unresolved inflammation from mycotoxins, it's not going to consume as much feed. If we have a high incidence of antibiotic treatments and electrolyte treatments, a lot of respiratory and digestive scours going on, well, that could be due to the immune system's having to deal with all the mycotoxin related inflammation. So tell me about your calves, Scott. Tell me how they're doing. And if they're not performing up to your expectations, let's start doing a little bit of troubleshooting to see what might be going on. And, over the last year, we've been testing quite a few starter feeds around the country. And some of these have been showing up relatively high in mycotoxins. And I think that's principally due to byproducts concentrating the level of mycotoxins in the base stock grain or whatever's being used to produce the byproduct.
So, two questions that, I think about with that comment is one, what is a concerning level in starter feeds,
Okay.
considering these small bodied animals? And two, they're not eating a lot of feed, right? They're not eating a lot of this grain. Starting out, they might be eating a mouthful a day. We're trying to get them up to 4, 5, 6 pounds, but even then, it's not like they're eating as much as a mature cow.
Exactly. Yeah. Well, how's this for an answer, Scott? I don't know. I don't know. Because what other factors are the calves having to deal with? With the cow side, we talked about herd indicators.
Yeah.
We talk about things like overcrowding. We talk about comfort. We talk about disease, transition issues. We talk about what's the manure look like with cows. We should be asking the same question on the calf side. Because if the calf has a good dry situation where it can lay down, it's not dealing with the cold, not dealing with the wind, that calf can probably handle a higher level of mycotoxins. It's got more nutrients to throw against this problem. But the higher the mycotoxin incidence, the more nutrients are drawn away from productive purposes, the more likely we are to see some of these other challenges. So, not to dodge your questions, Scott, but I don't know is that we really know. But if we watch our calves and their performance isn't what it ought to be, then we start doing the troubleshooting, and a place we need to look is that starter feed. What are the levels? And I think, if we start like, say, 1 ppm a dawn, I think we start to get where we need to be concerned about things. And then if we have multiple mycotoxins, multiple challenges are put upon the calf. So, Scott, that's not to dodge your question, but I think it's to truly address what we need to be looking at with the calf. We need to be thinking about our management. If we're group housed and calves are a little bit challenged for getting up, having enough time to go up and nurse from the automatic feeder, it's just not good aerial environment there. The bedding's wet and so forth. That calf is probably going to be more susceptible to mycotoxin issues at a lower level than if the calf was in a almost ideal type situation.
Sure.
So, Scott, you asked a very important question. I don't know if that we really know that level.
Well, it certainly begs the question to me, a question that I love asking. I ask you this a lot. What if?
Yep. Mm-hmm.
So, okay, we have 90% of our calves wean on time at the right weight. We get them weaned. We get into this awkward kind of post-weaning before they're really ready to take off on a TMR.
Mm-hmm.
A lot of times we see them go backwards. I mean, that's very common in herds. It kind of, you see these big, beautiful weaned calves, and you
Yep.
go look at that same group a month later, and it's like, have they really done anything kind of thing?
Mm.
So what if we made it routine to evaluate the diet going into that pre-weaned calf?
Yep.
Is there a possibility we get 99% success weaning, hitting our targets?
Yep.
95? What kind of impact does that carry on down the road? You know,
Absolutely.
if she's a late, you have a calf that doesn't wean on time, and if your program is to hold her back to the next group, now there's social stress, there's
Yep.
a hierarchy of dominance within that next
Yep.
group because they're a little bigger. If you push her through and she's not ready to take off, how many of those 10% of calves fall out of the program before they ever
Hmm.
freshen?
Yep. So that's where I come back to. Tell me about your calves. And if 10% of them aren't weaning on time, why is that? Why is that? And is there something that we can relate back to the starter feed being a source of mycotoxins? Let's maybe approach it from a little bit different angle. Let's just say that during the dry cow period, the cow was consuming a ration that had some mycotoxins in it. Some of those mycotoxins may pass through into that colostrum. If she's
Well,
having to deal with mycotoxins, she's not going to produce the colostrum quantity and quality that we want. So you see how this whole thing can kind of snowball, and we have to be thinking about what's the role of mycotoxins all the way through. And I'm not saying mycotoxins are always the problem in every situation, but they need to at least be considered. At least be considered.
well, and right, the epigenetic discussion, what happens with that cow when she's in utero with a calf,
Hmm.
everything that's negatively impacting her impacts the developing embryo,
Hmm.
impacts the developing gonads of that
Hmm.
offspring. It's a 3-generation multi effect. And I mean, Dr. Britt was on here last year talking to us about that. Larry, I think a number that's gotten a lot of attention over the last number of years, especially as beef on dairy has taken off in the US dairy market, is non-completion rate of virgin heifers. And I mean, yeah, we always want to be in a perfect world, we'd be at 1 to 3% non-completion rate. But in reality, there's a lot of farms running 10 to 15%,
Yeah.
sometimes even higher.
Yeah.
What would you say to those farms to challenge them to maybe think outside the box a little more? Just looking at more
Yeah.
angles and more,
Hmm.
what should they be really trying to do?
Hmm. Why do you think your non-completion rate is where it's at?
Yeah.
What do you think are some of the weak points? The cow that has a difficult transition period may very well have had a difficult pre-weaning period, may have had challenges at weaning. And why was that? Were there some pathogen issues pre-weaning, some respiratory issues? Could some of those be traced back to mycotoxins? So I guess I don't mean to sound like a politician. Mycotoxins may have a big role, they might not, but they at least need to be evaluated.
Yeah.
They at least need to be evaluated. And it's relatively simple. We need to know what's going on with dry cows. We need to know what's going on with our lactating cows. If we're feeding some of the hospital or waste milk to the calves, do we have some of those mycotoxins passing through in the milk and then causing issues with our calves?
I think something else to consider as well is like, so Dr. Billy Brown from Kansas State joined us the first part of the year here in 2025 talking about developmental program.
Mm-hmm.
I mean, if these calves are going through an insult, whether it be pathogens, whether it be
Mm-hmm.
mycotoxins,
Mm-hmm. Mm-hmm.
poor management,
Yep.
facilities, I mean, there's gene expression that gets turned off. Like these animals are never going to be the same, right?
Mm-hmm.
I keep coming back to this idea in my former life. One of the gentlemen at one of the stud companies made reference to the highest possible net merit that we know of was and I forget what it is now. It's in the thousands. I just hypothetically for the discussion, let's say it's 5,000.
Okay.
And we're at 1,300, 1,500, 1,600. There's a lot more things that we don't know that these animals can do.
Okay.
And, this big black box that is the research side, the university research side in calves, there's a lot of work done on calves of starter feed, what's better, high starch, high fiber, a lot of formulations of milk replacers. There's nothing in the way of what are mycotoxins doing. And part of it is it's a really long research project, right? I mean, how do you track this group of animals
Right.
for?
Yeah. And there's that aspect to it, Scott. But how many research studies that are evaluating, let's say, milk replacers? What level of fat, what level of protein, what level do you need to be feeding? Do they measure mycotoxins in the milk or the starter feed? Hardly any. I don't know of any that do that. How about research studies that are evaluating pellets versus a textured feed? How many of those studies measured mycotoxin levels? Are we really evaluating the form of the starter feed, or are we evaluating which form brought in more mycotoxins? So there's a whole lot of questions, I think, Scott, to be asked in that area. And so it's doing the completeness in the study that we know what else is going on. And I'm not saying that mycotoxins are the reason that every calf doesn't perform the way that we think it should,
No, absolutely not.
but it's something that needs to be evaluated and something that we need to know.
I think just like anything, Larry, when I would go to farms and do dairy comp analyzation, looking at farm records, well, if
Mm-hmm.
you don't track it, I can't consult on it. I can't give you any insights if there's
Mm-hmm.
no recordings of it, right?
Mm-hmm.
And I like to communicate the same thing to nutritionists and dairy farmers today, why we believe in a routine sampling program.
Mm-hmm.
If we're not routinely tracking the toxin load that's in the TMR, how can we give advice on it? And so I would
Absolutely.
almost challenge people to be thinking about that more with the calves. Like you said, it's definitely I don't want people to think we're preaching doom and gloom here because we're not.
Right. No.
Mycotoxins aren't going to be probably the most contributing factor every single time, but are they a contributing factor?
Are there
And so,
situations where they could be? Let's rule it out. Scott,
yeah,
we go to a calf raiser and health isn't what it should be. Have they evaluated their starter feed? Have they evaluated whatever they're using for milk to make sure that this is not an issue? Because we could be
oh,
chasing all of these other issues, and doggone it, performance just hasn't improved because we didn't address the main factor.
well, I think the other side of that too is we address these other factors and performance does improve, but marginally. We don't hit that level that we thought we could.
Mm-hmm.
And Larry, if I've said it once, I'll say it 100 times. If 1 + 1 doesn't equal 2, go look for mycotoxins.
Yep.
So, Larry, I'm going to ask you a Dr. Larry Roth question here. We have mycotoxins potentially affecting calves. So what? What do we do about it?
You bet. So what? We have mycotoxins affecting our calves. Well, it's going to determine the type of cow that we're going to have at some point. It's going to determine the type of feedlot animal that we have at some point.
Yeah.
So what? We got mycotoxins. Well, is it setting our calves up for more health issues, pre and post weaning? So what? We got some mycotoxin issues. Is it dragging the calf's immune system down so that crypto or cocci is getting a little bit more of a hold on the calf so that weaning comes along and they go backwards on us because of that? One of the big issues right now with beef on dairy calves, and I think should be an issue with native type feedlot animals, liver abscesses. If mycotoxins are causing a break in the castle wall, the small intestine lining, or potentially the rumen lining? Is it setting that animal up for liver abscesses?
Mm-hmm.
Potentially could be. Again, the dogma back in the last century, and you're talking to somebody who graduated from University of Nebraska when it was acidosis U, we assumed that liver abscesses were due to ruminal acidosis. Okay. But what if, be it a native beef steer or a beef on dairy animal, has some scours or has some mycotoxin issues pre-weaning? Is that animal set up for liver abscesses at that point? Let's look at it another way. Very interesting study in the Journal of Animal Science several years back. My good grief, it was about 10 years ago now. Went to a slaughter facility in the Midwest, and it was about 35% of the cull dairy cows going through this facility had significant liver abscesses. Wow.
Yeah.
Well, again, if dogma is it's ruminal acidosis that causes liver abscesses, were these cows really getting ruminal acidosis? I don't really think so. Maybe subacute, but probably not a severe ruminal acidosis could be. But 35% of them? Could these liver abscesses have been initiated pre-weaning? Potentially. So the liver is the body's biochemical factory. Liver abscesses mean our factory isn't working at the level that it could be. So why were these cows culled? Were they culled because they wouldn't breed back? Were they culled because of transition issues? Scott, I can make the case physiologically, metabolically, that the cow who doesn't breed back could potentially have liver issues. I can make the case physiologically, metabolically, that the cow having transition issues could have an impaired liver. And it all goes back to pre-weaning.
Yeah.
Congratulations, Scott. You've done the best job in the world genetically with your herd. Congratulations. But if we have some mycotoxin issues or pathogen issues, pre-weaning damages the castle wall, the small intestine lining, be it pathogens, be it mycotoxins, impair liver function to the point where we get some liver abscesses. Are your animals ever going to reach their genetic potential?
Well, I think that's the question, right? That we want to leave people with is think about the long-term, impacts here. But also, our colleague Jeff Hostetter just mentioned at the Pennsylvania Dairy Summit this past week, there was a discussion on what is it going to take to get to the 8-pound club, right? And stay there consistently. Again, I'm going to go back and say there's a lot of things that we are learning on how to feed the rumen better. There's things that we're learning to make these animals more efficient use of their nutrients. And I just think that, if until we start addressing these calves more closely and subsequently virgin heifers up to calving, Larry, I've said it before, these animals are no longer a commodity in the US. Let's not treat them like one.
Absolutely.
And good job to you old podcast pro, doing a callback for us, talking about the liver abscess. So if you're paying attention, that's episode 6, where Dr. Roth and I talked about why do liver abscesses plague both dairy and feedlot cattle. So good job, Larry. Good callback.
There you go. It's all one big cycle.
Yes, it is. I think you've given the audience something to consider. And, from I guess a call to action standpoint, if you are listening to this podcast and you want to contact us, it's podcast@agrsol.com. Reach out to us. We'll help you get a sampling program going on your farm, whether it's dairy, beef, doesn't matter. And if you're in academia listening, Larry mentioned how there's a lack of testing in that research world. Get a hold of us. We'll partner up. Larry, is there anything you'd like to leave our audience with today?
Scott, our main topic was mycotoxins and their effects upon calves. Mycotoxins are not the only challenge for the calves.
Amen.
But if we're trying to get the best performance out of our calves, both pre-weaning and long-term, let's do the troubleshooting. And one of those troubleshooting items has to be, are we dealing with mycotoxins?
Yeah. I just think so often there's so much value in just eliminating the things that it's not.
Yeah,
Right.
absolutely.
So, Dr. Roth, I did think of one more question, right? So, within the agrarian toolbox, within our portfolio, how can we help defend and protect these baby calves?
Yeah, fantastic question. So if we identify mycotoxins are an issue, so what? What are we going to do about it? Well, that's where I think first of all, our day one calf gel or calf bolus, depending on which a person likes, inoculate the tract with beneficial bacteria, outcompete the pathogens, bring in the egg-based pathogen-focused proteins to take those organisms out, eliminate them as a potential problem, because we're trying to build the integrity of the castle wall, the digestive tract lining, make it more resistant to mycotoxins. And then on a daily basis, supplement our big calf powder. Big stands for bacteria, and I can't say it, but the egg-based pathogen-focused proteins. Okay? Again, it's all about what can we do to build up the integrity of the castle wall so that it's more resistant to the mycotoxins. That's what I would be doing. What can I do? Control pathogens so they're not damaging the small intestine themselves. Anything that helps that calf be stronger, have a better immune system, is going to set it up to better handle mycotoxin related inflammation. You'll note, Scott, there's something I did not mention, and that's the DTX. We can't mention the DTX. We can't mix the DTX into the calf powder because some of it's going to settle out. We can't pellet the DTX because the pelleting so often is at a high enough temperature is going to kill our bacteria. So at this point in time, I would look at inoculating the tract at birth, replenishing the bacteria anytime that we have to do an electrolyte or antibiotic treatment, go back to the gel or bolus, depending on the preference, and then on a continual basis, be supplementing the big calf powder. Do everything we can to strengthen the digestive tract lining, control the pathogens, and enhance immune function to deal with any mycotoxins that might be coming along to cause challenges.
It's a great point, especially on the DTX. Plus, you have such an inconsistent feeding intake of starter grain during that pre-weaned phase, right? From just a little bit to multiple pounds. But I appreciate that insight. And I would just mention to people too that the program you just talked about with the day one gel or the in conjunction with Big Calf, I mean, we're looking at a $15 investment in an animal for the whole weaning phase, right? It's pretty marginal in the grand scheme of things. Well, Dr. Roth, I definitely want to thank you again for taking time out of your day to join us on Ruminate This. And I think we've given the audience something to think about. And I'll say it again, podcast@agrsol.com if you have any questions or would like to talk to us about implementing a routine sampling program on your farm. So with that, we will see everybody again next week.
All right. Thank you, Scott.
Thanks, Larry. If you found value in today's podcast, please hit subscribe and share. And we look forward to talking to you again next week.